This is the Boise Wellness Podcast, and we are interviewing health and wellness professionals in the Treasure Valley to help you live a better life. Hey, Amanda, thank you for coming to the podcast.
Thanks for having me. I'm excited to be here.
Yeah, it's exciting. Can you tell us a little bit? We were discussing off camera that you are an NMD. Can you tell me what that is and why that distinction matters?
Yeah, definitely. So NMD stands for Naturopathic Medical Doctor. It's confusing because in Idaho, NMDs go by NMD, obviously, but in other states, they go by ND, which is just Naturopathic Doctor. In Idaho, the legislation's a little bit different, so we have to go by NMD because we also have lay naturopaths here, which are people that also practice alternative holistic type medicine, but they have a different education than I do. So NMDs go to a 4-year medical school, similar to your typical medical doctor, but our education is different in that we not only learn pathology, pharmaceuticals, that kind of thing, but we also learn natural alternatives. We have classes for like nutrition. Your medical doctors have classes for nutrition too, but usually just 1 or 2. We have like 5, 6, 7 classes for nutrition in our curriculum.
It's a huge focus.
Yeah, big focus. We also learn a little bit of physical medicine, so chiropractic manipulations. Some people practice that, other people don't. It depends on the state and if that's in a naturopathic physician's scope in that state. In Idaho we can, but I don't.
Okay.
Because cracking a neck freaks me out a little bit.
Okay. Not your thing.
We also learn things like botanical medicine, so herbal medicine. The supplements that you see in the grocery store like curcumin and like boswellia, things like that. We really dig into the pharmacognosy, so how those botanicals work inside the body like a pharmaceutical. We also learn things like, what's the word? Like nature cure. I don't know if that term clicks with you.
Very much.
Nature cure is things like hydrotherapy. So
Okay.
really growing in the health and wellness space, cold plunges, sauna therapy, that type of thing.
Yeah.
And how does that actually impact our bodies in order to improve our health? We have classes specifically for how to apply heat and cold to the body in order to do things like stimulate the immune system, relax the nervous system. And then other types of natural therapies that people might have heard of, like homeopathy. That's something that we learn too, but not all naturopathic physicians practice.
Okay.
So a lot more comprehensive on the natural side, but we still learn things like pharmaceuticals. When is it indicated to send somebody to a specialist? We order lab testing, we order imaging, that sort of thing. So in Idaho, we can act as primary care physicians, ordering your annual labs, giving you your prescriptions that you need, but also giving you alternative, more holistic approaches.
Okay. So what does that look like then? Well, we can be more specific for your guys' clinic at Boise Natural Health.
Sure.
What does it look like? Who is searching for you? Who's coming in to see you?
Mm-hmm.
And what does that like first visit look like?
Yeah. So anybody and everybody can come to see us. The first visit is typically a 90-minute visit. So we go over a comprehensive patient history. We do physical exams. And we talk about whatever you want to talk about. Why are you here today? Some of my patients come to me for primary care. They're here for their annual visit. They don't really have a lot of concerns. They just want to get their labs done and then be treated accordingly with more alternative methods.
So would that be like blood pressure, diabetes treatment, all of that sort of stuff would fall underneath your scope?
Yeah.
Okay.
So we see patients for, like I said, anything and everything, but people come in for high blood pressure. They come in for diabetes. They come in for high cholesterol. We see a lot of patients for menopause type symptoms because we can do, the herbals that are really nice to kind of calm down hot flashes and things like that. But also we do a lot of hormone replacement therapy. So being able to prescribe things like estrogen, progesterone, testosterone are really helpful for our menopausal patients who maybe herbal medicine is just not enough to get them there.
Okay.
Yeah.
Is this something then that you are pretty consistently checking in with people? Like, let's say labs, talking about doing annual labs. Are you consistently checking like a huge lab every single year? Like, this is what your testosterone levels are, 20,023, and this is what it looks in 2024.
Not necessarily.
Okay.
So a lot of specialty labs that I order are patient driven. So if somebody comes in and they're like, I really want to get my hormones checked, I'm having these symptoms that correlate with some type of low hormone level, then yeah, I'm definitely going to check that. But I'm not going to check a testosterone in every man who comes into my office. So it's based on patient desire, if it's actually indicated, and what else they have going on and other risk factors they have. So sometimes patients don't really have anything going on and they just need an annual wellness visit. I order the same labs that their primary care physician might order.
Okay.
Yeah.
Okay. As far as your interests, do you have like a specific patient population that you're seeing right now?
Yeah. So I will see anybody for really any concern, unless it's so far out of my ballpark that I don't know what I'm doing. Then obviously I'm going to tell the patient that we're not the best fit. But my passion's really in women's health, GI health, and mental health, and how all three of those things kind of interact together. As we learn more about GI health and the microbiome, we learn that those bugs that live in our GI tract modulate our hormones. They either can ramp up the amount of hormones that we're reabsorbing, or they can make it so that we excrete more hormones. We also know that those bugs impact our mental health, and our mental health impacts our hormones, and our hormones impact our mental health. So it's this trilogy of things that all work together, and sometimes if we're just focusing on one, the other two are not improving, and so the one we're focusing on doesn't get any better either. So really all three of those things, working on them at the same time, I think really shows the most benefit in my patients that have hormone-related symptoms or GI or mental health.
Can you think of an example maybe of a patient that has been just a huge success story, like something that is I don't know, really indicative of how things can change with how you're applying natural medicine?
Yeah, definitely. I would say the biggest impact I see in patients is when I am working on mental health, because for patients, that's like the emotional piece. And the emotional piece a lot of times is what affects us most on the surface, and that's what we notice. So I also practice acupuncture. I don't know if I told you that. I have a certified, an acupuncture certification, not a licensed acupuncturist, but the school that I went to also teaches us acupuncture.
Okay.
So I didn't go to acupuncture school, but it's part of my naturopathic medical program. So in Idaho, I can do a couple of extra classes and be certified to practice acupuncture.
Okay.
All that to say.
But you can still use it.
Yes.
In what you do.
Right. So I can use it in what I do. So a lot of times in my acupuncture patients, I'll see this huge shift in mental health from the beginning of the treatment to the end of the treatment. So in 20 minutes, I've seen a suicidal patient go to no longer being suicidal. I've seen a patient who's traumatized because of a domestic abuse say, I feel normal. And I don't know why I feel normal, because I feel like I shouldn't right now. But it just calms the nervous system in a way that I haven't seen anything else do. And it's so fast. And it might not be lasting results. They might have to come back next week. But it's really the most rewarding part for me, because I can just see patients feel so much better. And it has such a huge impact on their life and the lives of the people around them.
So when you are using acupuncture, is it one of those things that you're using that as a way to bring quicker relief, and then you're also building a program around that with the rest of the natural medicines? I'm calling them medicines, but natural things that you can do?
Yeah, a lot of times I am. Acupuncture typically, in my experience, works fast, but doesn't always last. So I'm also bringing in supplements. I'm making lifestyle changes. We're talking about, what is really the cause or at the root of what's going on. This is a lot of times true for my pain patients too. People who are in chronic pain a lot of times can get fast relief with acupuncture. Like I had a patient in a couple of weeks ago. She's had foot pain for every day for a year. Doesn't want to get up to go to the bathroom because it hurts to walk. A couple of weeks I had her come in after her previous treatment. She said she had 4 days of no foot pain at all. Now, I don't think I cured the cause of her foot pain, but I gave her relief for almost a full week until she was back to her next treatment. And in the meantime, we can work on the things that are contributing to that pain.
Yeah, absolutely. as a physical therapist, I often will see that there are things that can really open like a window of opportunity. Like your pain went down. That doesn't mean the cause is gone, but we can actually do the exercises you needed to do because it's not killing you and sending you the wrong direction all the time.
Right.
So that's huge to be able to have that. You mentioned off camera that you do community, some sort of community acupuncture thing. Tell me a little bit about that.
Yeah, so I see patients privately for acupuncture. But because I'm a doctor first and an acupuncturist second, acupuncture is not my priority.
Okay.
Sometimes it's my patient's priority, and that's totally fine with me. But I'd prefer that my patients spend their healthcare dollars on their doctor's visits rather than their acupuncture appointments.
Okay.
So I've created this small chunk of time during my week that I can see patients in I call it a community setting, but it's not truly a community setting because not everybody is in one room.
Okay.
I still like to provide a private acupuncture experience. So I do it in the evenings when the rest of the practitioners aren't in my office. So I have use of all the rooms. So I put one patient in one room, one patient in another, one patient in another, and I just rotate between them. So while one person is, like how I like to say, cooking with their needles in, I could be talking to the next patient and putting their needles in. Then I can come back to the previous patient and take their needles out and get them on the road.
Okay.
So I call it a community acupuncture because I'm treating more than one patient at one time for a community acupuncture price while still trying to provide a community acupuncture or a private acupuncture experience.
Okay. Yeah, that makes sense.
That makes sense.
Yeah, that totally makes sense.
Yeah.
One thing that I've noticed with almost every health and wellness professional is you're running this fine line of taking care of everybody else and you need to take care of yourself. What are the things that you are focused on for taking care of yourself?
Yeah, well, I will say that living in Boise makes it easy, for me at least. I moved here in October from Phoenix.
Oh, okay.
So Phoenix can be a really active community if you're really into hiking, if you're willing to drive the 30 minutes or so that it takes to get to the nearest trail. But in the summer, it's unbearable.
Yeah.
You know, it's 120
right
degrees every day. I mean, here, when it's been 105 this past week, I'm like, oh, this is starting to feel a little like Phoenix, but I can still walk my dog in the morning. Whereas in Phoenix, it doesn't get below 100 at night, even in the dead of night. So the sidewalk never cools down.
Yeah.
It's hot no matter what. So moving to Boise has made my activity level so much better. There's so many people. I take the green belt to work sometimes. I ride my bike, and I'm surrounded by other people who are commuting to work. They're on a run, they're riding their bikes, they're walking their dogs, they're pushing their strollers. It's just such an active community.
Super active.
That really helps. And it's so motivating to me to be surrounded by other people who seem to be prioritizing their health.
Are you also seeing maybe another provider like yourself? Is that like how you're tracking your health and all of those sorts of things?
I really don't. I know that I should. But it's one of those things where sometimes when you're a practitioner, you're like, I can take care of it.
Totally, me too.
Really, you can't.
Yeah.
You are never you're the worst patient when you're doctoring yourself.
Yeah.
But that really brings top of mind that I should get on that.
Here's your accountability right here on this podcast.
Right. I told you I love the accountability.
Obviously, healthcare is always changing. There's new things coming out, and sometimes those new things are things that stay. Sometimes they're just fads. Are there just things that you're seeing coming down the road that you're excited about, that you're looking to explore?
Okay, so I really love this question, but not in the way that I think you intend it to be.
Okay.
So my favorite trend in healthcare right now is that health and wellness is a trend.
Oh.
And you see it everywhere. I scroll through Instagram for longer than I should. I'm not on TikTok yet, so I get the reels 2 weeks after things are popular on TikTok, but I see the things in health and wellness that are popular on TikTok and on Instagram, and it gets me excited that other people are getting excited about their health. And I don't think it used to be that way, at least not that I saw. And I think with the age of social media where everybody can share what they're doing all of the time, it can be a detriment because people will see things that maybe are treatments that aren't really appropriate for them or not really effective, or people talk about supplements. And most of us know that the supplement industry is tricky because there's no regulation on supplements. So it can be a detriment for some people. But I get excited when I see patients come into my office and say, I've been seeing castor oil everywhere on TikTok. Can you please tell me about it? Like, is it actually helpful? What does it work for? And then I get to have a conversation with patients about things that they're seeking out on their own. It just shows me how committed they are to being healthier, feeling better, and they're doing their own research and seeking out things that maybe they wouldn't have been able to before.
Yeah, absolutely. I think even in my field, it seems like people are able to see and find like a starting point for themselves. And so they're generally more educated when they walk in the door on like, oh yeah, I saw that exercise. They just need somebody who has a better handle on why you would use that, when you would use it, like how to dose things rather than just, okay, well, try whatever.
Yeah, and I've seen patients come in who are like, I brought this up to my regular doctor and they didn't really know anything about it and they didn't answer my questions. And I think that having people talking at you through your phone all the time makes you a better advocate for yourself because you are asking those questions of your provider. And I think people who have providers that don't answer their questions should find a new provider. Like, we're in an age where people know more. People are more excited. Just like you said, they just need some direction on when something is appropriate. But if you have a provider that's not willing to tell you when that's appropriate or not willing to listen, then that's probably a problem.
Yeah. And totally, like, we all use each other too, right? Like, I don't know anything about supplements or any of those sorts of things. I'm going to send them to Amanda.
Right.
Whereas my field is going to be back pain or, things like that. And so we all just depend on each other in the midst of that.
Yeah, that's why I love that you're doing what you're doing, not just for patients to find practitioners, but for practitioners to find other providers that can be in the referral network so we can get these patients to the right place.
Absolutely. Absolutely. Are there any other things that you are passionate about, just wanted to talk about on this podcast?
I don't think there's anything coming to top of mind. I just think the advocacy piece is really what I wanted to hit for people.
Okay.
Like, be your own advocate. Don't be afraid to ask your provider their questions, no matter who your provider is. If they're a conventional doc, they might know somebody who can answer your questions if they can't.
Perfect. Yeah. I have one last question, which is, how do people get to you? How do they schedule an appointment? Do they need a referral? What sorts of things do they need to be able to walk through your door?
Yeah, so the most important things for people to know are, well, I'm at Boise Natural Health Clinic, so they probably should know where I am. No referrals are necessary. We are a cash-based clinic, so that's one of the biggest questions we get asked from people is, do we take insurance? The answer is no, we don't take insurance, but we provide super bills. Okay. So some of my patients get coverage for their appointments. More often, they'll get coverage for acupuncture visits because more insurance companies are covering acupuncture these days. But I would say it's always worth a try to submit it to your insurance. And a lot of people use their HSA cards. Okay. So I would say the number one reason why people don't end up scheduling is because of that. So I think it's important to know. What's the rest of the question?
Just how do they come to the door? Can they just call and schedule an appointment? They don't need anything else besides that?
Yeah, just call and schedule an appointment. We also do 15-minute free consults. So I think that's a really useful tool for people because they don't always know if we're going to be a right fit. Okay. And since we don't take insurance, that's more of a financial, what's the word?
Like cost, financial cost.
Yeah, it's just a bigger cost for people if they have an appointment and they realize that I'm not the right person for them. So 15-minute free consults, or just schedule a new patient visit if you're sure. We also do open houses every other month. So people can come in and see the clinic, talk to all of the doctors that work there, see if there's one of them that's a good fit, and just see if the space is right for them.
Hey, we hope you guys liked that show. If you're curious about any links to the professional we just interviewed, you can see that down below. But just a little bit about us. I'm one of the hosts, Craig Flood. I'm a local real estate agent and helps people with residential and commercial listings.
My name's Trevor Schmidt. I'm a physical therapist at Activated Movement Physical Therapy.
And we came together to make this podcast to help people here in the Treasure Valley find wellness professionals so that you guys can live a healthy and active lifestyle.